Because the assessment process is a time to evaluate. It's a time to observe and understand where the body is during this time. So, with that being said, I have this ladder and then these bigger words here. So what we're looking at is, if I can explain this side first, I'll start at the bottom and then I'll go up. We have this posterior exterior chain, and then we have these three pieces. We have the left AIC, right BC, right TMCC, and then there's other iterations here. We have in a box neutral, and we'll talk about that in a second. And then we have steps beyond neutral. So I wanted to use some analogy to express the concept of going up a ladder in terms of progression. So many times within the assessment process, individuals may score a certain amount or in terms of range of motion, or they might score a certain quality. Right? They might have a certain testing quality about the certain movements that we assess. So many times we might even see individuals that represent this. So this acronym, PEC, posterior exterior chain. At its simplest, what we can understand is this is the process of which an individual may present in a certain bilateral status. So posterior exterior, the back and outside musculature. And then with this being said, we'll start here as this is not the baseline because it's at the bottom, but this is the 0 point, meaning you can't go further than PEC. There are other iterations of PEC, and over here, if you can see this, it says patho-PEC. So technically, it's in the same realm, but then there's just a offshoot of this PEC pattern, meaning you've gone so far down this movement pattern that now you are stretching beyond your limit. So there's sometimes when you go into a pattern and you stretch beyond your limits, and then it becomes pathological in nature. Not an individual is like a pathological liar, but rather it's abnormal. It's outside the expected norms. So PEC, you can't get lower than a PEC. You can have an offshoot of a PEC, patho-PEC. This is where we're starting. From here, we can progress or improve, and we can get out of this and go up a step. And then this is where a lot of individuals might go, it's a little complicated because this encapsulates essentially 3 or 4 courses.